Got to try and find a balance in my life where I don't overdo it, because I know I can't do as much as I used to do, and that's hard.
I think having any sort of heart problem, particularly heart surgery, your mortality really has almost hit you in the face at that point in time, hasn't it? I think the family tend to want to wrap you in cotton wool. You've experienced pain and sleep deprivation. You've experienced separation from your family. And all of those things suddenly think, what's my life going to be like now? And we need to put those pieces back together.
It is not unreasonable to tell people to expect to be home at day 6. They might be there for 10 days if they've got difficult diabetes, difficult lungs, or we're getting them onto blood thinners, warfarin. We have to stabilise their blood thinners. But an awful lot are itching to go home at day 6 and day 7. They should have somebody at home when they leave hospital, if they're going to leave hospital at day 6. And the sort of supports they need is a person who can call for help, who can do the shopping, who can do the general care. The person who has gone home, however, can walk around, they can dress themselves, shower themselves, they can go up and down a flight of stairs. But they should not be lifting, pushing, pulling for a period of time. They can't be driving a car. Those who don't have supports at home, though, may have to go to a rehabilitation area. And we have some good contacts with good places that can help people through that transition time of maybe 5 days in a rehabilitation facility.
In a traditional cardiac rehab program like the Phase 2 program, so Phase 1 being is while you're in hospital, Phase 2 is usually a program that is attended as an outpatient after your cardiac event, around about 4 to 6 weeks after your cardiac surgery, or after about 2 weeks after having a coronary stent implanted. So these programs will actually look at some of the risk factors that you may have, also in ways about how to change your own modifiable risk factors, and also how to manage a lot of those risk factors as well. It also gives you some encouragement to want to change. You'll also meet other people who have gone through very similar circumstances that you have, and some of them will ask questions that you may not have wanted to ask because you were too shy or you hadn't even thought of yet. So that's also a good one. It also gives you a lot of support that there are other people going through the same thing.
The benefit there is like everyone had their own little experiences and getting their own little aches and pains, and you could share different things and find out that, oh yeah, well, I'm experiencing that too, so it must be normal. And it was good to do the exercise, because like I say, when I first, always been fit and healthy, but when I first started exercising, there's a few little restrictions, the tightness of the chest, how far you could move and that, and it was, yeah, it's good to hear about all the different things, a little bit more, I suppose, they touched on the technical side of the way your heart works and things like that, so it was a good learning process there.
And it gives you some lifelong tips for management, because after all, coronary artery disease is a disease that is not curable yet, but we can control it well using medication and lifestyle factors.
I think a lot of patients that do go out on their own and don't have the backup of a group environment tend to not know their limits as well. They tend to lose motivation quickly and ultimately put exercise aside and focus more on living for the moment. We don't want to discourage people living in the moment, but we certainly want to encourage them to make part of that living an exercise-based program. So I think the group allows them to see what other people have gone through and then put that into their own life.
Attending a cardiac rehab program really enables the patients to gain more confidence, more knowledge, talk about the issues living with cardiovascular disease, working and getting back into their normal life, not only for them but also their family members also.
The medication and dietary part of it was where I thought I got the most benefit. So I would recommend it. I think it was really worthwhile and I'm really glad that I did it.
We have a big component in the cardiac rehab course, so we do 2 1.5-hour sessions purely on diet, giving them patients information on what they should be eating, what the most up-to-date recommendations, particularly from the National Heart Foundation, are, and just giving them information, advice and answering all of their questions, of which often there are many.
I stopped eating all the rubbish food that I used to eat, and I find that my weight has come down in just a matter of weeks, not doing anything specific physically other than my normal routines. But dieting is so much important part of the treatment that I'm going through.
There are multiple components to a healthy diet, but as a lot of dietitians say, really it is balance and variety. So it's not cutting out, there are 5 food groups, as probably most people know. It's very important to have a balanced diet with all of the 5 food groups. And within those 5 food groups, obviously, there are healthier choices and less healthy choices. The number one thing, in my opinion, and probably of the Heart Foundation as well, is to reduce our saturated fat, so the fat that comes from animal sources. We also want to have a diet high in fibre, low in salt, lots of fruits and vegetables, whole grain breads and cereals, water as our main drink, that type of thing. So just the very general recommendations that everybody says to do, but that a lot of people don't actually follow to the letter.
What we want to do with people with heart failure is to make you as active as you possibly can be, given your circumstances. And it might mean that we start you off, for some people that are quite frail, just simply doing some exercises in a chair, moving their arms and their legs. Other people can do a bit more, and we might say to them, look, we want you to go to a specialist exercise program under the care of an exercise physiologist or a physiotherapist to do some light weights under supervision. But one of the things that happens with heart failure over time is the muscles start to get weaker and you lose muscle strength. So the importance of exercise can't be overestimated. It's huge in terms of keeping you well. So even if you can go for a walk every day, it might mean that you can walk up and down your driveway or up and down the passage at home to start with and gradually build it up. But ideally, to incorporate some aerobic activity, some walking or cycling, and then some light weights, even at home if you're doing some arm exercises with a can of baked beans, just some gentle arm exercises would be really important. Ideally under the supervision of, as I said, an exercise physiologist or a physiotherapist.
A lot of people after something so significant as cardiac surgery or a cardiac event tend to become more sedentary and a little bit apprehensive about re-entering that sort of activity. We also see people at the other end of the spectrum who feel that they want to go and reinvent the wheel once they've had that sort of surgery or that event. And we need to make sure that they're somewhere in the middle and being safe and having this as a long-term objective to make change in their life.
The patient may be discharged on a number of drugs, and that can be a bit daunting for the patient preoperatively, particularly the patient that's not been on a great deal of a great number of drugs before the operation. But the drug regime in itself is often quite sensible, in that aspirin is used to keep the blood a little bit thin, to stop clots on the valve or to keep grafts open. There may be cholesterol medication and there may be blood pressure medication, and those are really the main areas to focus on post-operatively.
Try and take your medications at about the same time each day. Try and fit them in with what you're doing at home, and with your daily activities. A lot of us say, please take your medications around a mealtime, for instance, something that you're going to do every day, potentially whether that's breakfast or dinner. There are only a very small percentage of medications where the drug's absorption may be affected by food, and there'll usually be an additional label on those drugs on the label that suggests that they should be taken before food. Keeping your medications in a central spot in the house is probably a good idea. Keeping them where you're going to go to every day, whether it's near your breakfast crocs or so on. But keeping in mind who has access to that area. Okay, if you have little people that are around and children and so on, obviously we need to be safely handling those medications. And we also need to think about the environment that they're in terms of a lot of these medications are stable in normal conditions, but certainly you get the temperatures above 30 degrees or you get damp conditions, and some of these medications can break down. So it's important that they're in a dry, cool, darkish area, not necessarily your fridge, but certainly not on the windowsill or near your sink. One thing we need to be aware of, however, is that we do tend to go into a bit of automatic mode. And everyone's guilty of that at times. And you'll so-called wake up during the day and think, gee, did I actually take those medications when I was supposed to? Chances are that you have. And certainly if it's outside a couple of hours of your normal time, our advice to you is to not to worry too much about it and go on as normal at the next dose, rather than accidentally doubling up the dose of the medication that you've potentially already taken. It's much simpler to say, I might have missed it, let's go on as normal the next day. The ideal is to try and remember that drug each day, and sometimes we'll need a little bit of extra help. And people talk about the idea of medication management aids. One of those such things is called a dosette, where they'll actually have a box which has the days of the week along the top, and in fact, so Monday through to Sunday, and has compartments for the times of the days, whether it's morning, lunchtime, tea time or bedtime. And you can simply put your week's worth of medications into that box. And certainly also is useful to have if you're going away for that weekend down the beach house. Rather than taking the second suitcase of medications, you can take just that container, importantly with an up-to-date list of what's in there. God forbid if you fall ill while you're away, you've got that list with you.
It's very hard not to be on a bunch of tablets forever. But what is encouraging for people is to realise that having just faced death, they've now got a really bright future, and they will need to help themselves to achieve the best result.
We have an excellent resource here available from the National Heart Foundation, and this is a great book for looking back after your procedure and taking home and having a really good look. It tells you a little bit about the procedure that you've just had done. It also talks to you about your recovery and what happens next. There is a section in here on people that you can contact, so people like Beyond Blue or Quit Smoking or the National Heart Foundation. It also is available to everybody that has acute coronary syndrome, and also has an angina action plan which sits here in the back folder, and this can be taken out and just popped on your fridge for easy use.
We're living in a good age in terms of what is available, and as most of the treatments these days have minimum side effects, which is the good news. And the actual sort of techniques have improved over the years. So in terms of the time off work or quality of life issues, many people get back to a normal life very quickly even after heart surgery. So, and that's really what our aim is to, apart from keeping people alive, is to actually give them a good quality of life. So that's just as important as quantity as quality, obviously.
I had 3 months off work because I work as a firefighter, and I wasn't able to drive a truck for 3 months. I think that's by law. After having heart surgery, you can't drive a heavy vehicle for 3 months. I could have probably gone back earlier on light duties, but I decided to just stay off a couple of weeks longer, and obviously I had to have a stress test and everything done before I was able to do that and be cleared by the cardio doctor. But I've not had any trouble at all since going back to work, and I feel great, so I'm really happy with it.